So I guess asked a lot about eating and drinking and why is that important? Well, the ultimate answer is we don't want anything in your airway or in your lungs. When you're under general anesthesia, it's not that people try to actively throw up or things come up. It's that you're so relaxed, and especially if you're on your back or if we need to put the head of the bed down a little bit, we don't want passive regurgitation or just with gravity, any solid pieces coming down into the esophagus and into the mouth, which can inevitably possibly get into your airway. And that's actually an emergent situation and a frightening thing for not just us, but for our patients, of course. And so that is a no-go. If you, just to be super conservative, 8 hours is just an expectation of no solid food. So I personally prefer you don't eat solid food the day of surgery, even if you're a late start. I would rather you have something like Clear Ensure, which has some protein in it, but it's a clear liquid. And of course, during the 8 hours you're not eating, we are okay with you having clear liquids. Anything with sugars is okay. No creams, no pulp. As you can tell, solid foods and thick liquids are not what we want at all. Depending on who your anesthesia provider and their comfort level on something that's a slip up, that's going to be up to them. But many of us do not want to take on the risk of things if they're not done appropriately. So conservatively speaking, 8 hours no solid food. You can have clear liquids. If you want something with a little bit more nutrition, Clear Ensure up to 2 hours for it, especially if you have a long case that day and you want to just get a little something in you so you're not deprived of nutrition for a long period of time. That Clear Ensure, and I think you can get it on Amazon, not to promote any particular company, but I know it's been difficult at some grocery stores to find. You might be able to find it at a local grocery store. But you can go ahead and have that. Some of them have some colors to it. Personally, I'm okay with that. A lot of times we say no red liquids because we don't want to be perceiving that that's blood or something coming up. But as long as you have, a clear liquid or something that's not real thick with any pulp or any solids in it, you should be in the clear. So if you have any other questions about what you can and can't have, just ask your anesthesia provider during your anesthesia consult. And you can verify that also with the surgery center. There might be slight discrepancies based on just comfort level. The anesthesia provider is ultimately the person who is going to make the decision as to whether or not they are comfortable with taking you back to the operating room based upon what you've eaten or not eaten and what you've drank and not drank. So make sure to ask those questions then. Thank you.